My name is Eberts. I'm an obstetrics and gynecology practicing physician at Women's Care of Wisconsin, and I'm the president of the company. My route to where I am is rather strange, I think, compared to most. Didn't know any physicians and didn't know I was going to go into medicine. So I went to college after the military and decided I would try and just do the hardest and most interesting thing. And so started as a biochemistry major, even though I had never taken a chemistry class. I thought I would fail out, so lo and behold, I was actually doing really quite well. So I kind of grew into the passion of medicine. I went to one of the larger institutions in the world, a very famous program, and the professors of obstetrics and gynecology were hands down wonderful teachers. They were nice, and they taught, and they were engaged, and they show a passion for their patients that sometimes you didn't see in other services. I kind of was shocked a little bit that I thought, oh my gosh, I may actually be interested in this field. People always ask you, what kind of doctor you want to be, what kind of doctor you want to be, and it's an interesting field because it is challenging. So I need to know how to do anesthesia. I need to know how to take care of babies. I need to be good in the operating room. I need to understand medicine. It's really a field that spreads from one side to the other, from infertility, predominantly younger, healthier patients, to cancer patients, 60s, 70s, 80s, doing big surgeries. And so I was really into obstetrics. When I first came out in private practice, I was doing a very heavy load of delivering babies. Over the years, I do less obstetrics and a lot more reconstructive pelvic surgery. So stress incontinence, prolapse, those things that people don't want to talk about. But when people come in with an issue, it's very important that they understand not only the plan, but, and this is what I think is very often missed, what happens if that plan doesn't work? First we're going to do this, and this is how long we're going to give that plan to work. Then this is going to be what plan B is. And if that doesn't work, here's plan C. Gives them time to think about it, gives them time to contemplate questions, gives them time to do their own internet research, as scary as that is. But that way, when it doesn't work, they don't disappear. They don't think, well, my doctor tried and it didn't work and I just have to put up with it. No. So I would hope that they walk away with a better understanding of the anatomy and the options that are out there. So the future of women's care. I think we're at a very comfortable size right now in the area that we are. In the long run, the goal for women's care has been and should continue to be to not accept the idea that because we're in a smaller market that we have to be second rate. We need to keep pushing that envelope and staying up on the science and staying up on the practices and staying up on the surgery. Some of that's just seeing things from the patient's eyes. What can we do better?